Hey guys, it's Doc Heps here with UroCoach. So you're thinking about your prostate PSA testing and you're wondering when the heck should I get this done? What does it mean? Check out our video. I'll give you the scoop. Hey guys, it's Doc Heps here with UroCoach. Make sure you subscribe, like, comment. We love to hear from you. So in this video, I'll be going over some of the basics regarding PSA testing. We'll talk about what PSA is, when you should get a PSA test, when it's elevated, and when you should be concerned. And stay tuned at the end. I'll give you my insight as to how I approach PSA testing. So what is PSA? PSA testing is something we as urologists deal with every day. It's considered our bread and butter. It's something that I find rewarding, but also challenging because there's no black and white answers to this. There's a lot of gray. So PSA is an acronym. It stands for prostate specific antigen. PSA is a protein that's produced exclusively in the prostate cells. What it does is it liquefies the ejaculate. Basically, it helps break down some of the fluid in the semen to help the sperm fertilize the egg. It's a normal protein, but it will leak into our bloodstream in very small amounts, and that can be picked up as PSA or prostate-specific antigen in the blood. So when should you get a PSA blood test? Well, some studies have suggested, and I agree with the general concept, that you should have a baseline PSA blood test sometime in your 40s. PSA can be a strong predictor of the development of prostate cancer over the next 20 to 30 years. So for example, if you have a very low PSA in your 40s, somewhere that's less than 0.7 or so, that your risk of developing significant prostate cancer is very low. Now, if it's above 0.7, even though this is considered a normal value, then we might want to watch you a little bit more closely. Also, if you have a PSA that's above 1.5 and you're in your 40s, then that's someone who we might watch you regularly with PSA testing. So a baseline PSA blood test in your 40s is a good way to stratify how aggressive we should follow you. Now, how often do you need a PSA test? Well, like I said, it probably depends on that initial baseline. So if you have a very low baseline PSA in your 40s, then you probably don't need another test until you're 50, 55. It kind of depends on your preference. Now, our guidelines suggest that every couple of years is fine, and that's what some of the European studies have suggested. But the PSA is relatively cheap, easy test to do. It's not like going and getting a colonoscopy, but I think that it's all in the interpretation of the data. So my philosophy is that a PSA test starting in your 50, 55, at least once a year, along with a baseline stratifying PSA, is the way to do it. So what is an abnormal PSA and why might it be elevated? Well, abnormal PSAs are considered age-based. So in general, what I follow is a PSA that's more than 2.5 in someone who's in their 40s, more than 3.5 in someone who's in their 50s, more than 4.5 in someone who's in their 60s, and we bump it up to 6.5 to 10 in someone who's in their 70s. Now, this is an interpretation of the guidelines, and you'll see if you look in your Quest or LabCorp testing, it'll say 4 and under is normal. But really, it's not an absolute under 4 you don't have cancer and above 4 you do. It's something that needs more interpretation, more nuance. Do you have a family history? Has your PSA been changing? But those are general guidelines that I use for numbers that would sort of trigger me to say, hey, we should further evaluate. And again, how quickly, how often should you evaluate is kind of based on that baseline PSA testing that you had in your 40s. What can raise your PSA? Well, a number of things can raise your PSA. Prostate cancer can, an enlarged prostate can, inflammation of the prostate can, or any infection can commonly increase PSA artificially. So what's the first step usually? Well, in 20 to 40% of patients, if you repeat that number, that PSA number in a few months, that PSA will normalize. So usually the first step is say, hey, let's get another PSA test, because the PSA unfortunately is not a very specific test. It'll pick up most prostate cancer, but it will also give false positives. So we want to repeat that PSA to ensure that it wasn't just a bump in the road, an artifact. And then there are other more nuanced versions of testing that can help provide us some more information. This includes a free and total PSA test. So PSA usually floats around attached to a protein in our bloodstream. And the combination of that PSA that's floating free and the PSA that's attached to the protein is called the total PSA. So common blood tests can measure the free fraction. And if you have a free fraction that's more than 25% or so of the total, the likelihood that that elevated PSA is benign is very high. On the inverse, if the free fraction is pretty low, less than 10%, then we're more suspicious that the total PSA may be more reflective of a significant cancer. So a free and total fraction, which is a blood work test, which is an easy and relatively cheap test to get, may provide some additional value in interpreting that total elevated PSA number. Another component that we use is something called PSA density. PSA density really gives us a sense of how much PSA is being produced per unit of volume of prostate tissue. Now, if you have an enlarged prostate, we're going to expect that there's going to be more PSA produced. So there are certain numbers that we use to guide us. So for example, if you have a 40 gram or 40 milliliter prostate and your PSA is 4, we call that a PSA density of 0.1. So if your PSA density is 0.1 or less, generally that suggests a more benign course. Whereas if your PSA density is elevated above 0.15 or 0.2, that would be, for example, if you have a PSA of 4 and your prostate is small, maybe only 20 grams or milliliters, that would indicate a PSA density of 0.2. Then I'd be like, hey, your PSA, you're producing more PSA than I expect for the amount and size of your prostate, and maybe we should consider further testing, potentially a biopsy. So if you have a baseline PSA and you're monitoring it and all of a sudden it bumps up that threshold value and you want to repeat the PSA, you want to potentially obtain a free and total PSA fraction, assess your PSA density. Another component could be how fast that PSA is changing over time. In general, if the PSA bumps up higher than 0.75 nanograms per milliliter, then you may want to further investigate that. So that how fast the PSA changes is also a component that we take into account. And then you'd have to consider, is it worthwhile doing an anatomic study? There are also further tests that are more sophisticated than PSA alone. These include a 4K blood work test that looks at certain proteins. Remember, I talked about certain proteins are attached to the PSA molecule. They can see certain components of the SNP proteins that are attached to the PSA. Also, there's something called the Prostate Health Index, which is another blood work test that again looks at certain proteins attached to the PSA molecule, and they can provide us another number to maybe more accurately assess your overall risk of significant prostate cancer. An anatomic study would be something called an MRI, which would give us a measurement of how large or small the prostate is, and also guide us if there are any lesions within the prostate. In summary, a baseline PSA testing somewhere in your 40s is very reasonable. If your baseline is elevated, I would keep a closer eye on you and get your PSA at least yearly. If your PSA is very low, then maybe we don't need to get another PSA for 2 to 5 years. Then if your PSA becomes elevated in 20 to 40% of folks, that PSA is going to normalize on a repeat test. So I repeat a test and potentially consider more nuanced testing, such as a free and total PSA, a 4K score, a prostate health index score. There's urine-based tests that also can look at prostate cells and look at the genetic profile of those prostate cells and see your overall risk of significant prostate cancer, and then consideration of an MRI of the prostate. That's usually my algorithm for treating men with an elevated PSA. Hopefully this was helpful in describing what to expect with PSA testing, when to get it, and what to do with it. Make sure you subscribe, like, comment. Make sure you check out our website, realurology.com. Thanks for watching.